Congratulations on choosing the LumaCool tooth whitening system. From the previous program, you already know about the many advanced features you and your patients will enjoy. Now let's start to put the system to work for you. First, when unpacking the box, be sure that all the components are present. You should have a base assembly consisting of the following: a base with casters, a support wheel, a pole with black rubber grommet, a pole cap, a bolt assembly, and assembly instructions. Your shipping carton also contains separately the LumaCool head and arm assembly with power module and remote control, and a box of materials to supply you with everything you need to perform your first several bleachings. Before proceeding, you'll need a few simple tools: a small adjustable wrench, a screwdriver, and a pair of blunt forceps. Carefully following the assembly instructions, first assemble the base unit by bolting the pole and then securing the support wheel using the 2 bolts that come with the pole. With the base unit thus assembled, carefully follow the instructions for securing the LumaCool head and arm assembly. An assist from a second pair of hands makes this part of the assembly much easier. Finally, connect the power module and the assembly is complete. Let's make sure that we've assembled the system correctly. Plug the power module into a wall outlet, point the remote control at the LumaCool head, and push the start button. That's the button on the top right. The LEDs should illuminate, and the window display should start to count down from 8 minutes. After 5 or 10 seconds, push the same start button again to shut off the system. Read the timer on the display window, then push the Adjust button on the top left to reset the system to 8 minutes. By experimenting, you'll find that the Adjust buttons, top and bottom left, will reset or adjust the time in 15-second increments. Your LumaCool system is now ready for use. With the system now assembled and operating, let's follow a typical bleaching procedure from start to finish. Bear in mind that the following procedure has been developed and refined from experience gained in doing many dozens of cases. By following this protocol, you can expect maximum whitening and optimum outcomes. Remember, not every patient will respond the same way to the whitening process. It's important that you explain this and set the patient's expectations realistically. To this end, have the patient read and sign the patient-informed consent form, copies of which are included with your package of starter supplies. If the bleaching is to be performed by an auxiliary staff member, it is highly recommended that the patient be examined prior to the procedure by a dentist to rule out any cavities, recessions, or other anatomical anomalies that may affect the patient's comfort or the outcome of the procedure itself. Now, let's prepare the materials that will be needed and set them aside for easy access. We will need a shade guide, some 2x2-inch gauze pads, some cotton rolls, an explorer, a curing light, a pair of scissors, a medium surgical tip attached to a vacuum source, a mirror for the patient, and the protective eyewear that came with your system. All the LumaLight materials we will be using can be purchased in bulk through your dental dealer. However, the single patient kit used in this demonstration offers the convenience of having everything you'll need in a single box. It contains a cup of pumice, some vitamin E swabs, syringeable LumaBlock gingival barrier, 3 ampules of 35% hydrogen peroxide, 3 cups of LumaWhite catalyst, a supply of bendable brushes, a pair of cheek retractors, and a bottle of Stay Bright whitening enhancer for the patient to use post-operatively at home. After getting the patient comfortably seated, take a pre-op shade match. Digital photographs taken before and after make a great permanent record of the procedure. Pumice the teeth using the flour of pumice supplied, then have the patient rinse. Install the cheek retractor and place cotton rolls on either side of the frenum where needed to expose the margins. Hold a vitamin E swab vertically and firmly in one hand with the red score line facing up. Snap the score line so that the liquid inside the swab begins to drain to the cotton tip on the bottom. Now gently swab around the corners of the retractor as well as the patient's lips to keep them moist and comfortable during the procedure. The vitamin E will reduce any unlikely sensitivity to the lips and exposed tissue. Vaseline applied to the inner surfaces of the lips will also help to keep the patient comfortable. A saliva ejector is not always necessary, but may be inserted at this point if the patient requires it. Now, starting at one corner, apply a generous bead of Lumablock across the margin, extending it about 1 millimeter over each tooth. It's best not to cover more than one quadrant at a time before curing the material. Be sure to cover all margins as well as any exposed dentin, cementum, or papillae. Cure the Lumablock using a slow, flowing motion with the tip of the light about 3/4 of an inch away from the material. Use an explorer frequently to test that the cured Lumablock is rubbery and not brittle from overcuring. Now it's time to prepare the gel. Open a cup of Luma-White catalyst, set the cap down, and using a pair of scissors, snip open an ampule of hydrogen peroxide. Carefully add it to the cup of catalyst and mix gently for about 10 seconds until you achieve a nice, smooth, gel-like consistency. Apply the mixed Luma-White gel to the teeth using one of the bendable brushes supplied. A consistent coverage of 2 to 3 millimeters on the buccal surface as well as on exposed incisal areas is ideal. Make sure there is no exposed dentin showing on the incisal areas. A good technique is very important here. Always brush away from the margin to avoid touching any unprotected soft tissue, and be aware of any spots of Luma-White gel that may inadvertently transfer from your gloves to the lips or other exposed areas. If such areas are accidentally contacted by the bleach, quickly wipe it off with a damp gauze pad and swab the affected area with vitamin E. With the patient in a comfortable upright position, move the illuminator head of the Lumacool and center it into place about 1/2 inch away from both arches. Note that the digital timer on the display window is preset for 8 minutes. Aim the remote control towards the head of the Lumacool and push the start button. The LED lights will activate and the timer will start to count down to 0. At the end of the cycle, the lights will go off and the unit will reset itself for another 8-minute cycle. Swing the Lumacool head out of the way and, using the medium surgical tip, vacuum up the used bleach from the teeth. Then, wipe away any additional material left using a 2x2 inch gauze. Do not rinse at this time and be careful not to contact exposed tissue with the gauze. Now, mix a fresh cup of Luma-White bleach as before, apply a fresh coat to the teeth, and reposition the light for a second 8-minute cycle. At the end of the cycle, suction up the used gel and wipe the teeth as before. Now mix up a third cup of Luma-White gel and repeat the above steps as before. Most patients will achieve their maximum whitening after 3 cycles. If, however, the teeth are gray in shade or are particularly resistant to bleaching, a 4th and final cycle may be recommended. At the end of the final cycle, after the gel has been vacuumed off, you may now rinse the teeth using copious amounts of water and vacuum. Then remove the gingival barrier using an explorer tip to carefully lift it away from the gums. Remove the cotton rolls and cheek retractor. Check the mouth and gums for any blanched areas and treat these immediately with a vitamin E swab to reduce any discomfort or sensitivity. Since over the next few hours the teeth will continue to whiten as much as 1/2 shade, some clinicians choose to wait 10 or 15 minutes before taking a post-op shade match. This would be a good time to provide the patient with take-home instructions emphasizing that they must avoid tobacco and teeth-staining foods and beverages for at least 48 hours after treatment, since teeth are especially vulnerable to staining during this period. Also, instruct the patient on how to use the Stay Bright material that was included in the kit for the patient's use. A 3-day course of Stay Bright applied to the teeth twice a day will ensure that they will reach and maintain their maximum brightness. Now, take a post-op shade match and hand the patient a mirror.
Wow, that's amazing.
The LumiCool Light may be used with virtually any commercially available gel, including Gentle Bright, the newest offering from Lumalight's continuing research to bring you leading-edge technologies in tooth whitening. Gentle Bright's active ingredients include enhanced chlorine dioxide, which, when exposed to the LumiCool light, will generate oxygen radicals to bleach away tooth discoloring chromogens. Since it is a non-peroxide bleach, however, and since it is well tolerated by soft tissue, it can be applied directly to the teeth without the need for preparing a gingival barrier, as was demonstrated in the previous case. A significant time savings indeed. The LumiCool Tooth Whitening System. By becoming familiar with the protocol described in this program, you should be able to complete most bleaching appointments in 1 hour or less and build a following of happy, satisfied patients for your practice.